Now in Better Health, we visit the stroke ward where we see how they're continuing to improve stroke patients' care.
I'm Wendy Busby. I'm the lead acute stroke physician on the Dunedin Hospital site, and I'm part of a team who are developing coordinated stroke services across the southern DHB region.
Hi, I'm Marita, and I'm Marita Harrison, and I work in the stroke unit as the lead stroke nurse, and I've been doing that for about 4.5 years. And just help coordinate between the MDT and the patients, and just a very strong advocate role for the patient.
The service really ideally is a service that's going to start from preventing people having strokes, working with people who have what's called transient ischemic attacks, managing people acutely when they do have a stroke, and this is why we've got the acute stroke unit here at Dunedin Hospital. Making sure that we prevent secondary stroke recurrence, working very closely with the rehabilitation teams, and of course working to optimise people's recovery so they get back home with the highest level of independence.
We're into the early rehab right from the time the patient comes in, getting them moving, just working with the different therapists with their mobility and their speech, and just how they're just coping with their normal activities of daily living, and just to try to get them as independent as possible, as quickly as possible.
Stroke is the third largest cause of death in New Zealand, and in fact it's the largest cause of disability in adults, so anyone can have a stroke. Typically it's usually an older person, and risk particularly increases from about the age of 50 onwards, but sometimes even children can have strokes. In general, people who come into stroke services are usually in their 50s, 60s and older.
Well, I had a mild stroke.
How did you know that had happened?
I lost control of my right leg from about the knee down, and of course you get in here as soon as you can.
If you do have a stroke, we want you to ring 111 and to think about the FAST message: face, arm, speech and time is brain. Because for every 2 minutes that you don't have blood supply to your brain, almost 2 million brain cells die. So if you're having a stroke, pick up the phone, ring 111, call the ambulance.
Well, I've been seen by physiotherapists, by doctors, by occupational therapists, by nurses. The treatment has been just tremendous.
Well, every member of the hospital team's involved. I mean, the linchpin on a day-to-day basis are the nursing staff, because they're monitoring the patients, interacting closely with the patients, promoting independence, and we're particularly working to early mobilisation. We work with a team, with nurses, physiotherapists, occupational therapists, speech and language therapists, the rehab team.
Also, we have a role in trying to promote health while we're in here, because of course patients come with a big cohort of people that share the same risk factors, their environmental and genetic risk factors, so we try to do a lot of health promotion while they're in here too, to help prevent secondary prevention of stroke. So yeah, and those sort of just had a TIA, it's really, really important. We do a lot of prevention stuff with them just to help prevent them from having one. Lots of education about it, recognising stroke symptoms obviously.
And particularly people who've got risk factors for stroke, so things like smoking, hypertension, heart disease, diabetes, these will put you at increased risk of having a stroke.
Good coordinated care, everyone working together on the same page, and just working, involving the patient and their family, and just that early mobilisation, early recognition obviously of the symptoms, and actually getting the treatment on board. Just learning to cope with a completely different sort of physicality, and the shock that their body has let them down in some way. If you got hit by the big blue bus, you could blame the big blue bus driver, but this is something that's come completely out of the blue. Sometimes your biggest problem in the morning is whether to hang your washing out, and then boom, all of a sudden you've lost the power on one side of your body. It's amazingly hard. Primary
Prevention's got to start out in the community, so there's a whole variety of things that need to happen there. But certainly here within the hospital, we run a TIA clinic, a transient ischemic attack clinic, where we try and see people within 2 working days when people have symptoms of a stroke that completely go away, because they are high risk for going on to have another stroke. And really, stroke involves every part of a person's life. So we're not just talking about the brain and circulation, we're talking about being independent and the other impacts, other health issues that you have to be aware of.
Firstly, they're so professional, and secondly, nothing is a problem. And their personalities, I don't know, they're just wonderful. Try and get a bad word out of any of them. Just try it.
Making a difference in people's lives, and sometimes we can't fix them, but we can make them a lot more comfortable, and it's actually quite pleasing just to do small things to make a bad situation a little bit better is probably the best part of the job.
The patients and the staff. I mean, everybody's completely different. It's also a very challenging job. Sometimes it can be very difficult to sort out whether someone has had a stroke or a TIA. So really getting the diagnosis right, making sure you're offering people the right treatments, working as a member of a team. So there's a whole lot of fantastic things that occur in this area.
Any shortcomings, help is available.
Fantastic. And of course we don't want you to have another stroke, do we?
No, thank you.